ABA therapy is basically an application of the science of behavior on how to teach functional skills. So we teach pre-academic and academic skills, daily living skills, and then we also use those procedures to reduce problematic behavior with our children. So we have a lot of fun with our kids. A lot of our learning takes place in the playroom, so we're constantly teaching while we're playing with our kids. We try to be really high energy, have high enthusiasm, so when you really observe those sessions, most of the time it looks like play and it looks really fun and exciting. I think that some of the complaints about the compliance issue kind of comes from our lack of analysis as adults. So when we think about when we're deciding not to be compliant with another person, it's usually because we're making complex discriminations. So we're saying, okay, under these circumstances, it's not good to be compliant, so I'm not going to be compliant with this request. So for instance, if my boss asks me to do something, I'm generally going to be pretty compliant with that request. But if a stranger asks me to do something that I don't want to do, it might not be appropriate for me to comply with that. Well, with our kids, we have to start somewhere, and we can't teach them those complex discriminations if they don't have a basis of compliance at all. So it's really important that we teach them to be very compliant with the things that we ask them to do. And as their language skills increase and they can make those discriminations, then we focus more on, okay, under what circumstances are you not going to comply with another person? Generally, when a child is compliant with their therapist, we usually see that translate over to mom and dad. Sometimes, though, we do need mom and dad or the caregiver to come back and actually do the therapy with a child in our clinic setting so that we can make sure that that skill generalizes to the home environment as well. So when talking with families who've received ABA services in the past and it's left a bad taste in their mouth, I would definitely say to do your homework. There is a board certification for behavior analysts, and that's an international board certification. But in the state of Florida specifically, there's no licensure for behavior analysts. So really, anybody could be calling themselves a behavior analyst, but not be practicing ABA, and there's really no repercussions for that, which is very unfortunate because the services that they're providing could, not be in line with what we're doing. So I would definitely look into that. Then I'd also say communication is key. Here at BCOTB, we provide a lot of supervision with our therapists, and we make sure that they're implementing procedures exactly the way that we want them implemented. We're also constantly communicating with parents. So I'd say do your research, make sure that the practitioner you're with is actually a board certified behavior analyst. And I would also say make sure that that communication line is very open and that you're feeling heard and that your wants and needs are addressed. So I've heard some claims that ABA therapy is abusive. I haven't heard a lot of specific complaints, but the one thing that jumps out to me is that ABA can be very emotional. So we have kids that come in who their whole life, maybe for 2 to 10 years, they have learned that crying or whining or flopping or engaging in self-injurious behavior is a way to get their wants and needs met. And that's really a communicative deficit. What we do here is we make sure that they learn more appropriate ways to get their wants and needs met. And often in that process, you get more whining and crying. You get more problem behavior initially because we have to teach our kids that that's not an appropriate way to get your wants and needs met. And we have to break that cycle. So there is that emotional aspect to it. It can be very hard to watch our kids whine and cry and not receive the cookie or the ball or whatever they're trying to access. Instead, we focus on teaching them to sign or to select a picture or to talk if they're vocal, or even something more appropriate like gesturing or reaching towards that item would be something that we want to teach them to do to get those wants and needs met. So it can be very hard at first for parents and for us to watch that process, But it's an important process because if you think about your child, when they're 2 and 3, it's probably very easy to manage if you're whining, crying, flopping for something. But when you're 23, it's extremely difficult to manage. And we want to make sure that we give our kids the greatest opportunity of success. BCOTB believes in early intervention because it provides our kids with the greatest likelihood of success. So if you think about it too, a lot of our kids will come to us with a fair amount of problem behavior, and a lot of times when we work on those problem behaviors, at first you'll see a little bit of an increase. Well, it's a lot easier to ride that out with a 4-year-old child, than with a 12 or 13-year-old child where the aggression can get, pretty intense. So it's definitely beneficial to start to work on those problem behaviors at a young age so that when the child is older, it's a lot easier to manage and you don't have those same problem behaviors. On another note, if you think about it, if you're coming to us, at 8 or 9 years old and you don't have a lot of pre-academic skills, it would have been better to come as a younger child and really work on those pre-academic skills because we really want all of our kids to be in a mainstreamed classroom. And if you're coming to us as a younger learner, we can definitely work on those skills to make you more successful for the classroom.